subcutaneous injection demo. First thing we're doing is just checking the date and the time. Today's February 7th, 2021. Right now the time is 0:25. Okay, next thing we're doing is comparing the physician's orders to the MAR. This is for Nursing Jake. Nursing Jake, fitness 312-312-654-654-987-987. Date of birth is January 1st, 1960, January 1st, 1960. Dr. Skills Hub. And as you can see, the patient has no known allergies. Okay, the first medication we're going to be giving is metoclopramide. Dose is 5 milligrams. Route is subcutaneous. Time and frequency is once daily is 0800. Nobody's given that and signed off for it yet, so I will be giving that. Okay, next medication is diamond hydronate, 150 milligrams. Dose route is intramuscular. Time frequency is once daily at 2100. Right now the time is 0:25, so we will not be administering diamond hydronate. And as we can see, both of these are signed off by transcriber and reviewer, and I can see that patient has been admitted for uncontrolled nausea secondary to chemotherapy, so I will be keeping that in mind. Okay, now I can put my physician's orders away. I can do hand hygiene before I start pulling on my medications. Okay, here's medication I will be needing. This is metoclopramide. Dose is 5 milligrams. Over here, this medication comes in 10 milligrams per 2 mLs, 5 milligrams per ml. Okay, and the route is subcutaneous. This is an IM/IV vial. So in this situation, I will be calling the pharmacy to get approval that I can give this medication subcutaneously, and I have called the pharmacy. The pharmacy has given me approval to continue with the procedure and give this medication subcutaneously, even though the vial indicates IM/IV, since this is just an off-label use of the medication. Okay, now I'm going to be using the parenteral drug monograph to get some more clarification regarding this medication. Okay, this is metoclopramide. This is an antiemetic for nausea and vomiting. Okay, and this can be administered by a nurse or a student nurse, such as myself. And the maximum daily single dose is 20 milligrams, and I'm only giving 5 milligrams, so we have nothing to worry about right there. And this medication can be given intramuscularly and subcutaneously. I administer undiluted. Okay, so I've clarified that it can be given intramuscular/subcutaneously, and the maximum concentration we can give is 5 milligrams per ml, which is exactly the dose we're giving. And some potential hazards regarding this medication are drowsiness, fatigue, dizziness, agitation, and headache. Okay, so I will be taking those into account when I do my patient education and when I monitor for my patient. Okay, and before I start drawing for my vial, this vial is not expired. This is good to give from. Okay, I'm doing hand hygiene now before I get my supplies. I'm going to be needing a 3 ml syringe. 3 ml syringe, since I'm drawing up 1 ml. I'm going to be needing a 25 gauge 5/8 inch needle. 25 gauge 5/8 inch needle, which is the appropriate size for a subcutaneous injection. And I'm going to be needing a blunt fill. Okay, so first thing we're doing is just doing hand hygiene, getting an alcohol swab, and I'm going to be wiping the top of the vial for 30 seconds in a circular motion. And I would be doing this for 30 seconds in a clinical setting, but right now let's just say it's been 30 seconds of cleaning. Okay, second thing we're doing is getting my syringe. Now I'm going to be getting my blunt fill. Be literally locking that onto the syringe. And now I'm going to be pulling the plunger back to about 1 ml, which is what I'm going to be injecting into my vial. I'll be injecting that. I'll be lifting this upside down. Okay, I do have more than 1 ml in here. So I'm just going to be putting that back down, and I'm going to be scooping this. I'm going to be capping that. Okay, I'm just going to be pulling all the medication back into my barrel. I'm going to be using a pen to get rid of any bubbles. I've gotten rid of all the bubbles. All my medication is within my barrel. I'm going to be transferring this to my needle. Literally locking that onto my discarding that. And this this bun fill does go into a sharps container. This bun fill does go into a sharps container where it obviously can't hurt anybody. Okay, I will be disposing that into the sharps container, and I'm just gonna be priming my needle now. Okay, I do have more excess, so I'm gonna be putting that over my med waste container, and I'm gonna be getting rid of that. So I'm gonna be going over my med waste container. I'll be getting rid of what I don't need. Okay, I have 1 ml over here, which is my desired dose. Okay, I'm gonna be scooping that, capping it, and this is 1 ml. You can check it. Okay, now I'm gonna be making my drug label for that. For nursing Jake, drug name is metoclopramide, subcut. Subcut dose is 5 milligrams of 1 ml. Concentration is 5 milligrams per ml. Date and time is February 7th. 2021 08/08/25. MKUMSN year 2. Okay, now I'm just going to be performing my second check after I put this onto the top of my syringe. Okay, now I'm going to do my second check. This is for nursing Jake. Nursing Jake. The medication name is metoclopramide. This is metoclopramide and metoclopramide. And the dose of the medication is 5 milligrams. This vial did come in 10 milligrams per 2 ml, 5 milligrams per ml, and 5 milligrams per ml, which is why I have 1 ml of medication in this vial. Okay? and it's not in this vial, I'm in this syringe. And this medication was subcutaneous. This vial did come in a IM/IV route vial, so I did get clarification from the pharmacy and the parenteral drug monograph that I can administer this medication subcutaneously. And this medication also has a subcutaneous needle gauge and a size on there, and yeah, so that's appropriate. And then the time frequency of medication is once daily at 0800. Right now the time is 0825. This has not been given. And so I can go ahead and administer that. Okay, now that I have done that, I'm just gonna discard this vial. And when getting my supplies for my patient's room, I'm gonna be needing my syringe. I am gonna be signing the MAR with a pencil just for demo purposes, but in a clinical setting, I would be signing with a black pen. And I'm needing my clean gloves, alcohol swab, and cotton pad and alcohol swab. Okay, now that I have my supplies for a patient's room, I'm just going to be heading into a patient's room. Upon entering a patient's room, I'm just going to be doing my entry safety check, making sure the bed is in the lowest position possible, call bell is in reach, patient's not in distress, there's no tripping hazards. And once I've done that, I'm going to quickly just go ahead and set my supplies down, perform hand hygiene, and after I do that, I'm just going to introduce myself to the patient. Hi, Mr. My name is Mohit Kaushal. I'm a student nurse from the University of Manitoba. I'm a student nurse from the University of Manitoba. I'm going to be taking care of you today. Do you mind if I just check your verify your ID with your armband? Perfect. Okay, nursing Jake. PIN 312-654-654-987-987. Date of birth January 1st. Dr. Skills Lab. And as we can, and over here it says no known allergies. Okay, and could you please tell me your full name and date of birth, please? Nursing Jake, perfect. Date of birth January 1st, 1960. Perfect. And do you have any allergies? No allergies? Perfect. Okay, Mr. Jake, I'll be right back. I'm just going to be doing my third check by the bedside. Okay, now I'm just going to be performing my third check. This is for nursing Jake. and the medication name is metoclopramide, and this is metoclopramide, and the dose is 5 milligrams. The dose is 5 milligrams. The vial did come in 5 milligrams per ml, 10 milligrams per 2 ml, which is why I have 1 ml in this syringe, and the route is subcutaneous. This is a subcutaneous syringe and needle, and the vial was IM/IV, but I did get clarification from the pharmacy and the parenteral drug monograph that I can be administered this subcutaneously. And the time frequency of the medication is once daily at 0800. Right now the time is 0825, and it has not been given, so I can go ahead and give that. Okay, after I've done that, I can quickly just go ahead and do some patient education with my patient. Okay, Mr. Jake, I'm just going to be giving you your metoclopramide today. Your metoclopramide is an antiemetic. It's just for the nausea and vomiting you've been experiencing regarding your chemo treatment. And before I give this medication, I'm going to be taking your full vital signs and assessing the current level of nausea that you have. And I've done that, and all of your vital signs are stable. They're in a good range for me to give this medication. And you will also have nausea, which indicates that I should be giving this medication. And after giving this medication, I'm going to be monitoring your vital signs every hour. And some side effects that you're going to be experiencing regarding medication are some dizziness, drowsiness, headaches, and agitation. And if you experience those side effects, please use your call bell and do not hesitate to call me. I will be here as soon as possible. And I will be monitoring for the therapeuticness of this medication, which is to prevent your nausea and vomiting. Okay, now that I've done my patient education, I can just start landmarking where I'm going to be giving this medication. First, I'm just going to landmark on myself. I'm going to be going 5 centimeters away from the umbilical cord, and so I'm going to be going in this lower part of the abdomen, and I'm going to be gripping. I'm going to be gripping fat. I'm going to be bunching up the fat. I can bunch up to 2 inches of fat and give it a 90 degree angle, or whichever angle suits my patient's body weight and size. Okay, and once I've landmarked now, I'm just going to quickly do hand hygiene before I put on my clean gloves. Okay, and now I'm just going to take my supplies to where I'm going to be injecting. Opening this up. Just going to be discarding this. First, I've already landmarked where I'm going to be giving it in the lower abdomen. I'm just going to be wiping the top where I'm going to be injecting for 30 seconds in a circular motion. Okay, we can just say that's been 30 seconds right now. But I would continue for 30 seconds. Okay, now I'm just gonna uncap my needle. Okay, I'm gonna be bunching the skin. My patient has a lot of subcutaneous fat, so I can go down on a 90 degree angle. Okay, and now I can stabilize. Inject slowly. Unstabilize. And then take it out. And then I will be activating my safety mechanism in a clinical setting, but for right now, I'm not going to be activating it. And I'm just going to cap this, and I would put this in a sharps container where it belongs. I'm just going to leave that right there, and I'm going to putting a cotton ball over where I inject it for 30 seconds, just to make sure it doesn't bleed. And let's just say that's been 30 seconds for now. Okay, we can just discard of all the garbage that we have, and this would go in the sharps container, like I said. I can take off my clean gloves and toss these two. Okay, once I've done that, I can just do hand hygiene. Now I can sign the MAR. And again, in a clinical setting, I would be signing the MAR with a black pen. But for demo purposes, I'm not going to be doing that. Okay. Okay, I've given that medication. Okay, I'm just going to be talking to my patient before I leave. Okay, Mr. Jake, I've given you your metoclopramide. And if you do experience any of those side effects that we talked about, please use your call bell and call me as soon as possible. I will be here as quickly as I can. And I will be back in about an hour to monitor. I'm going to do your full set of vital signs and and I will monitor for the prevention of the nausea and vomiting that you've been having, which is the therapeutic effect of this medication. And before I leave, I'm just going to be doing my exit safety check. And before I go, do you need anything? No, you don't need anything? Okay, perfect. Before I go, I'm gonna do my exit safety check. Make sure the bed is in the lowest position possible. Call bells in reach. There's no tripping hazards, and the patient's not in distress. Okay, once I've done that, I'm good to go.